Let's talk about management of inguinal hernia. All inguinal hernias should be repaired by elective surgical operation unless if there are specific contraindications, right? So the contraindications can be absolute or relative, right? Absolute contraindications to surgery include acute infectious diseases, decompensation state of the cardiovascular, respiratory, and other vital systems, myocardial infarction, acute phase of stroke, presence of incurable diseases like neoplastic processes, right? So these are absolute contraindications. Relative contraindications include the second half of pregnancy, hernia in children under 1 year, exacerbation of chronic diseases until stabilization, presence of urethral stricture or benign prostatic hyperplasia, right? Is BPH, benign prostatic hyperplasia. So herniotomy is performed after their examination. Patients can choose to wear trusses or bandages, right? So they are only prescribed if the hernia is reducible, right? This is contraindicated in irreducible hernia. However, these trusses are unsatisfactory in general. They do not treat the hernia, and the patient is still at risk of incarceration, that's obstruction and strangulation, right? So if we talk about the surgical approach, there are three main principles, right? Approach to the hernial gate and the hernial sac is called herniotomy. Manipulation of the hernial sac and closure of the hernial gate, that's hernioplasty, right? So surgery is usually performed under general anesthesia, but local or regional anesthesia is also used, right, depending on our specific condition, which I will talk about later. In direct hernia, the sac is not opened and should be taken to the medial aspect due to the presence of bladder, which should be emptied before surgery. The hernial sac is separated and opened, and the contents of the hernial sac are moved into the abdominal cavity. The excess sac is excised and the peritoneum is sutured, right? So let's talk about the methods of hernioplasty, right, depending on type of tissue we are using. Firstly, there is orthoplastic tension repair. This is also known as simple hernioplasty, right? So in orthoplastic tension, we are using ortho-on, right? So we use a patient's own tissue to close the hernial gates, right? And this can be fascial aponeurotic, muscular aponeurotic, or muscular. This method is used in patients with small oblique inguinal hernias and in patients with congenital inguinal hernias. In other cases, preference is given to repair of the posterior wall of the inguinal canal, right? This will be Bassinis, Postemski, Shoudis repair, right? The second method is called alloplastic tension-free hernial repair. This uses synthetic material, right? The most commonly used is a polypropylene mesh. Depending on the position where you put this mesh, there is onlay, inlay, and sublay, right? Onlay is also known as premuscular, right? So is anteriorly here. You can see it in blue, right? Inlay is in the position like at the junction, right? And sublay can be divided into three, right? There is a sublay retromuscular, right, just behind the muscle, and sublay pre-peritoneum, right, just before the peritoneum. And then there is sublay intraperitoneal, right? You can see it down. My case, I cannot reach down, but you can see, right, sublate intraperitoneal. Specifically for inguinal hernias, there is a method proposed by Ivan Lichtenstein, right? It's called Lichtenstein's method, right? So you can see here, rectus sheath is flipped out together with internal oblique muscle, right? You can also see the external oblique aponeurosis here. And here is the polypropylene mesh, right? The third method is laparoscopic hernial repair, right? So we can do this by narrowing the dilated inguinal ring with 2 to 3 sutures, right? So this method is mainly used in children. Is also known as total extraperitoneal or TEP. We can also do this by preperitoneal alloplast, right? In this case, a synthetic mesh placed between the peritoneum and abdominal muscles on the side of the abdominal cavity is called transabdominal preperitoneal or TAP.